A network is only as good as the number of engaged users it has. Many platforms and applications do not succeed because they fail to build a critical mass of engaged users. Over the course of the COVID-19 global pandemic, a surge of health surveillance applications were developed in an effort to reduce the number of infections. These applications were developed by firms both big and small. While many nations globally are making the use of surveillance applications voluntary, some countries have mandated the use of an application. When adoption is voluntary, however, health surveillance apps struggle to reach a critical mass of users. As it stands, there is no coordinated, systematic way of detecting and tracing outbreaks and emerging viruses. The Sabeti Lab at the Broad Institute of MIT and Harvard have been developing the first comprehensive end-to-end infectious disease surveillance system, named Sentinel.
Sentinel is a proactive early warning system to preempt pandemics.
Sentinel will use a three-part approach to detect viruses, connect data systems, and empower the healthcare community, allowing public health experts to respond to emerging viral threats in real time. The suite of applications is designed to track emerging viruses before they spread and stop them in their tracks. Public trust and adoption of the Sentinel suite is a priority for this institution. Public trust is crucial to improving a community's participation in contact tracing efforts, thereby mitigating an infectious disease threat. The Broad Institute is seeking better to understand how to build public trust and adoption of these mobile applications within the Sentinel suite for epidemiological surveillance. Using a literature review, case studies, and qualitative interviews, this policy analysis exercise explores digital contact tracing solutions to address the following questions. What are the most effective ways to encourage user adoption of surveillance systems? And what elements are avoiding and blocking the adoption of surveillance systems? Contact tracing is a vital public health tool used for controlling infectious disease outbreaks. The method is used to track infections between infected and susceptible individuals to stop the spread of an infectious disease. Contact tracing can be critical to mitigating an infectious disease outbreak, but privacy fears may keep it from becoming successful. Aside from general trust, there are questions related to the efficacy of Bluetooth technology and other contact tracing methods, including GPS, Wi-Fi, QR code tagging, ultrasound, and CCTV with facial recognition. Contact tracing apps may have the following goals, depending on the application's jurisdiction. Find more close contacts. Deploy a large-scale contact tracing operation that otherwise would be unable to respond sufficiently to an infectious disease outbreak. Perform the same actions as human contact tracers, but via a private alert system, giving the guidance contact tracers would give to exposed users, but anonymously and automatically. And perform a contact tracing operation more swiftly than with a human-led contact tracing effort. As seen in the COVID-19 pandemic, widespread adoption of these platforms is a major problem. Initiatives to encourage uptake of app-based contact tracing should enhance perceived benefits and self-efficacy. A discrete choice experiment was conducted in a nationally representative sample of 900 Dutch respondents to determine potential uptake of a contact tracing app in the Dutch population. As seen in the study, a main challenge in app-based contact tracing is to increase uptake among older adults, who are least inclined to install and use a COVID-19 contact tracing app. Additionally, a large study using anonymous online surveys in France, Germany, Italy, the United States, and the United Kingdom found strong support for app-based contact tracing. Contact tracing can suppress the spread of COVID-19 if high enough proportion of population uses the app, and there is public support for app-based contact tracing to suppress an outbreak. As with all strong policy, a public program should have support, capacity, and value. Let's explore how one institution tried to achieve just that. Google Flu Trends was a platform launched in 2008 by Google to help predict the outbreaks of flu. It provides estimates of influenza activity and made predictions about flu activity for more than 25 countries by aggregating Google search queries. The idea was that when people are sick with the flu, many search for flu-related information on Google, providing almost instant signals of overall flu prevalence. The platform performed nominally during the 2009 H1N1 pandemic, but failed miserably in 2013 by missing the peak of the flu season by 140%. It was then that Google quietly shut down the program. Why did Google's program fail to predict flu prevalence when it was needed most? Google's efforts were well-intentioned, but were opaque in regards to method and data, making it dangerous to rely on Google flu trends for any decision-making related to public health. Google's algorithm was vulnerable to overfitting seasonal terms and related to the flu. Additionally, search behavior changed over time. Contact tracing can produce very detailed data. However, not all jurisdictions have that level of resources, and many may not publish or record a large amount of information for privacy concerns. This study explored two platforms, with a focus on the platform's value proposition, application deployment, elements blocking adoption, and framing surveillance to the public. The New Zealand COVID Tracer application is a mobile application launched by New Zealand's Ministry of Health in May 2020. New Zealand Prime Minister Jacinda Ardern said the app could best be described as a digital diary, helping people to record their personal movements, adding the data would not be shared to anyone else beside the user. An interview with Therese Egan's, Principal Policy Analyst in the Public Health Systems and Systems Strategy Director for the New Zealand Ministry of Health, revealed the value proposition for why an individual would use a contact tracing application as being simple. If there were an infectious disease outbreak, all of the community would want it to be stopped as soon as possible. Even the most well-intentioned individuals fall short when asked to routinely check into their contact tracing app, argues Egan's of New Zealand's Ministry of Health. The user may either forget to access the platform or may experience functional difficulties within the app itself. And as COVID-19 cases dwindled to zero in the New Zealand community, complacency also became an issue. Originally founded as MIT Safe Paths, the PathCheck Foundation is a global nonprofit with a mission dedicated to creating healthy and resilient communities by protecting public health, containing pandemics, and strengthening economies, while preserving individual privacy through privacy-preserving innovation and research at the intersection of technology and public health. The foundation was founded at the Massachusetts Institute of Technology in March 2020. Khalil Luisi, head of global implementation for the PathCheck Foundation, argues one of the reasons why an end user participates in this program is self-preservation. In the interest of self-preservation, if there is any way to mitigate the spread of a disease with a high mortality rate, then an end user would want to download this tool. Additionally, from an economist's perspective, another reason for why a large majority of persons should participate in a program like this is productivity. If you have a population of incapacitated people due to an illness, then you have significantly lowered the productivity at the community or country level, which could have disastrous consequences to the economy where everyone suffers. If you have a tool that is able to send out notifications saying to quarantine after being exposed, then people who aren't infected can continue their daily lives and go to work. You maintain some productivity and avoid a total economic shutdown. For PathCheck, there were a number of barriers to implementation: capacity issues, capability issues, policy issues, efficacy questions. This is a novel technology, so there's not a lot of data to support any claim that this can actually be beneficial outside the way that the technologists imagined it. Getting the application downloaded by users too was a barrier for PathCheck Foundation, mostly due to weak institutions in the US and the lack of trust. At a time when the pandemic was heavily politicized in this country, wearing a mask was a problem. If wearing a mask is a problem, what makes you think a person will download an app with the ability to track locations, says Luisi. Also related to the context of public health, if you don't have data centralized in one place, it is difficult to make informed decisions. In this case, these decisions are life or death, warns Luisi. Using the criteria of institutional capacity, sustainability, and public trust, preliminary recommendations for the Sentinel suite and the Broad Institute include framing the platform as a containment and recovery suite following the COVID-19 pandemic, develop demonstrations of the suite that are publicly available, pilot the suite with various levels of jurisdiction while evaluating its performance using key performance indicators, and garner larger institutional support to help develop a more robust capacity for the surveillance suite. Next, the study will interview internal stakeholders within the Nextdoor app to evaluate its community-oriented model in the Bipartisan Commission on Biodefense, an organization of former high-ranking government officials that assesses U.S. capabilities to defend against biological threats, to explore means of finding support for platforms like Sentinel.